tobacco and substance use prevention. So happy to be here.
My thought for today is I appreciate your patience. This is a novice. This is the first time I've led GoToMeeting. I've participated in them, but this is the first time I'm leading this initiative. So I appreciate your patience getting this started. But my thought is kind of some housekeeping things. If you wanted to, in the chat box, just put your name and what locations or location you work at throughout the WIC offices. My thought is too to keep folks on mute throughout this, and we'll have some time maybe we can unmute at the end, just because sometimes that creates an echo. If you have questions throughout the presentation, go ahead and put those in the chat box as well, and myself and Daniela will be kind of managing and monitoring those throughout. Some tricks some tricks that I use as part of GoToMeeting. If you kind of the top of the screen, I'm going to share my screen shortly, but if the top of the screen, you'll see everyone's picture, and you can make that smaller, and which makes the actual presentation bigger. That's one little trick that I have thought seems helpful. And I might pose some questions as throughout this presentation as well. And if you could go ahead and just kind of put some of the answers in the chat box, that would be most helpful. And again, we'll kind of take some time at the end to answer any questions that we didn't get to. Sound good? So I'm going to go ahead.
Can I just interrupt real quick? I'm not sure if everybody knows where the chat box is.
Oh. It's a little.
So if you guys look at your screen, up at the top right, there should be a little like thought bubble. If you click that, it'll open up the chat and you can enter in your information there.
Thank you.
Yep, no problem.
Awesome. So I'm going to go ahead and share my screen. As part of today, I actually created a Prezi. So I will pull that up. And so the background, part of our job is working with the Maine Health Centers of Tobacco Independence, CTI, and they provide kind of 3 initiatives there: treatment, which is the Maine Tobacco HelpLine, education and training, and prevention. And through that is the Nonclinical Outreach program, NCO, and we'll kind of go over the process of that as well today. But the piece of prevention, those 3 pieces, the treatment, education, and then prevention, that's where we kind of, Daniela and myself, come in. There's Maine Prevention Services, MPS, and with those is District Tobacco Prevention Partners, and that's what myself and Daniela are. And what we do is we prevent tobacco exposure, whether through schools or municipalities, by reducing exposure to secondhand smoke in homes, higher education, hospitals, behavioral health agencies, and lodging, as well as the promotion of tobacco treatment through non-clinical outreach and youth engagement. A little bit of introduction about this is, thinking about tobacco and talking about tobacco. Maybe thought the folks think like, I don't like talking about tobacco. It makes me feel uncomfortable. Maybe I myself am a current user, or a former user. What type of leg do I have to stand on? People might say I'm not interested. So you know what? Not interested. I'm going to kind of move on and, ask the next question or the next topic that I have to cover with my clients. Does it really help when I ask? And, I really don't have time. I don't have anything, I can't add anything more on my plate. I really am very limited with these clients, and I really don't have time to cover this. My hope is for today, in 20 minutes, we'll cover 3 things. That offering help is important. You can do it quickly and effectively, and you can be confident you're making a difference. So a little bit of data. So the first question, I'd love to use the chat box. Most people who use tobacco start using regularly around what age? "16, 13, 12, 15, 13, awesome. And most pick up in their teens. It's kind of a broad number. But, the 12 to through 15, those teens, and 90% by the age 18, 95 under the age of 25. We know that our brains are still growing and developing until we're around 25, so someone can become very addicted very quickly. The next question, on average, people who use tobacco start thinking about quitting tobacco blank after starting. So how long? A couple years, a couple months? I have a few guesses in the chat box. So on average, people who use tobacco start thinking about quitting tobacco blank after starting. 3 years, 5 years, 4 years, 10 years. That was answer 1. So answer 2, research shows that most people start thinking about quitting tobacco about 2 years after starting. So something to think about too, folks, is that if you've been smoking for 30 years, that's 28 years of thinking about quitting. Or you smoke for 10 years, that's 8 years of thinking about quitting, because after you start thinking about 2 years after you start. Going back to that beginning. And then the last question I have, most people try to quit blank times before they are successful. People try to quit blank number of times before they are successful. 10, 12, 15, 18, 10 times. I'm going to quickly go back to that. Most recent, up until a couple years ago, that we would say the average was about 7 to 8 times. And now a 2017 study came out, and it can be as many as 30 times. So again, something to be mindful and thoughtful, to wrap our heads around, like 30 times. Think of someone that's tried to quit 30 times. That can feel really discouraging. They can feel defeated. So something to think about too, is that people might say, you know what, I've tried, and not for me. So a little bit more data continued. This takes a look at about 70% of tobacco users want to quit, and about half will make an attempt each year. And this is national data. This takes a look at quit attempts by age. 18 to 24-year-olds, around 80%, 25 to 44-year-olds, about 60%, 62, 45 to 64 is around 60%, and then 65 plus is around 54%. And this is in Maine for 2017. This next slide, that graph is pretty small on the left, but basically what it's saying is looking at age, income, and education. It doesn't matter. It doesn't matter, the quit attempts. Percentage of people who made a quit attempt in the past 12 months. Age, income, and education does not matter. This slide takes a look at the helpline. So when we compare, unassisted, meaning they didn't use nicotine replacement therapy, they, didn't utilize any services, whether it's the Maine Tobacco HelpLine or online programs, the quit rate is about 3%, that kind of cold turkey, versus a 26%. And I don't want to discourage also folks that quit cold turkey. That absolutely can happen, and it does happen, but looking statistically, it's around a 3% rate. Versus overall helpline quit rate is 26%. And that looks at 7 months. So if you look 7 months later, they follow up. And so out of 100 people, 26 of them remain tobacco free. And this is an overall quit rate. So this takes into account the people who are in the full program and those also who didn't. So sometimes folks maybe call once and don't complete the 4-call series. But this next slide takes a look at, again, that 3% of unassisted, but then that rises if you complete the 4 calls through the helpline, it increases to 36%. And again, this is over 7 months, and this is when folks utilize the 4-call series. They use 8 weeks of nicotine replacement therapy. So it's really something to think about. It's really beneficial to encourage patients and clients to quit. Maybe they to try to quit, to use the Maine Tobacco HelpLine, to participate as many calls as they can, and to use medication, because we know it can increase the chances and the success of a quit. So messaging. What message are you sending if you don't ask? You know, people are really like, most people know, you know, that they should quit. They should quit smoking, they should quit vaping, they should quit tobacco. Maybe they're expecting you will say something about it. And if you don't say something about it, they might think, oh, it's not that important. They've given up on me. Maybe I'm just one of those folks that can't be helped. Or, you know, maybe I'm just, you know, the one that can't quit. This slide just takes a look at patients report a higher satisfaction with their provider. This is a little clinical, but when they are asked about tobacco. And again, kind of back to, we know quitting can be hard as well. And 3% success rate unassisted attempt. Sorry. This slide takes a look at just looking, you know, patients who receive assistance from a provider, you know, are 2 times more likely to quit successfully. And, you know, each intervention increases the likelihood of a successful quit. And on the right-hand side is that kind of, it almost looks like a fundraiser thermometer, and that kind of inches up, you know, the kind of each time thinking about like money towards that fundraising thermometer, but thinking about, you know, asking about tobacco. And each time you ask, maybe that kind of grows and grows and grows until they make a quit attempt or they have quit successfully. So asking is so, so very important. And folks know, you know, that tobacco is bad for them. I kind of mentioned that earlier, but this slide just takes a look at, you know, the multiple cancers and the chronic diseases that are affiliated from a tobacco-related illness. In red, that is kind of the newer cancers and chronic diseases that they have found. But, you know, something to wrap our heads around too is that it's not just lung cancer. It's not just a heart attack. So that, sorry, what can I'm kind of, it goes pretty fast. What can I say? Statistics like, what can I say? So that, you know, kind of a simple 3-part message can be really effective. I care about you and your health. It's important to do something about your tobacco use, and I can refer you to the Maine Tobacco HelpLine. There isn't a, you know, a magic wand, there isn't a magic script, but you can, you know, kind of think about and kind of tailor it maybe to your client. But you can, what you can say in 1 minute, and this is kind of taking that 3-part message that we just kind of talked about. I care about your health. I think it's very important to me to address tobacco use. I can help and want to help. What do you think? We can make the referral right now. And so thinking about the Maine Tobacco HelpLine and what that consists of. You know, it's a professional counseling program that takes place over the phone. What happens when someone calls is the helpline receives a referral, and then the helpline specialist calls that person. And when you refer someone, and we'll kind of take a look at that, we'll actually go right to the site and what that looks like. But when you refer someone, you can put in, you're in the driver's seat. They can say, call me between 8 and noon, Mondays and Friday. You know, you can kind of set the precedent of when you can be reached. With that being said, they call, accepted services, a person is enrolled, counseling begins. Maybe the person is called and they decline services, not interested at this time. The client still receives print materials to their home, to their mailing address. Another option is obviously not reached. And they're not going to call you every day, you know, 10 days in a row. They will make 3 attempts throughout like a couple weeks, but it won't be every day, you know, 10 times in a row, like I said. And again, even if they're not reached, that print material will still be sent to that individual. So they still will be receiving that information for if and when they're interested in quitting down the road. So there's multiple ways to connect. What we'll really focus on today is using the quit link. But there's also, you can refer through fax, provider fax, provider electronic medical records. There's also an email that you can use if you have questions, Maine Tobacco help.mainehealth.org as well. And also with the Maine Tobacco HelpLine there's a voucher program. And I'll quickly go over this, but to be eligible, you need to have either no insurance or you're underinsured. And with that, you have coverage for nicotine replacement therapy, whether it's the gum patch or lozenge, up to 8 weeks. The participant can pick up the nicotine replacement therapy at their pharmacy of choice. You say, hey, I want to go to the Walgreens in Winthrop, and they'll call that in, and you just have to go pick it up, and it's free. And the calendar year is 6 months. So if you enroll in the tobacco program, Maine Tobacco HelpLine, you utilize the program, 6 months later, you're eligible for the medical voucher program as well. And that's pretty text heavy, but it says, basically the nicotine replacement is given over three calls. The first call, they give you a 2-week supply. Second call, they'll give you another 2 weeks. And then the third call, they'll give you a 4-week supply. Basically, they want to check in. They want to check in with you. And with that, they create a customized quit plan. And also that says, in 2015, there's about 6,500 vouchers that were dispensed, and 83% of those were nicotine patches. I also wanted to make mention that folks that are enrolled in Maine Care are not eligible for this program. They're obviously eligible for the Maine Tobacco HelpLine. They're just not eligible for the medication voucher program because they have that coverage benefit through the Maine Care plan. They're obviously, again, still eligible in the counseling, just not the nicotine replacement therapy because, again, they can get that through Maine Care. So the quit link, and I'll kind of quickly go over this just because I'll actually pull up the page, but you can register for services, which we'll talk about today. You can begin a quit plan, connect to a quit coach, and receive resources all on that website. We'll go over this. You can go to the quitlink.com/quit referral, or just the quit link, and I can show you where the drop down is. And this may be a refresher for a lot of folks. And obviously, kind of taking a look at that number 1 is going to the website. Number 2 is obviously when you fill this out, you're filling it out for someone else, and your role should be listed right there, and a drop down for WIC. And obviously, you're going to fill out the client's information for callback, not your own. And the last part is submitting the form, filling all that out. And again, I kind of mentioned the best times for the Maine Tobacco HelpLine to call. So they're in the driver's seat. And then you submit the form. And again, we'll kind of go into, we'll actually kind of play around with the website. So what if a person declines? Don't be surprised. No's sometimes outnumber yeses. You haven't done anything wrong. And, you can kind of just say, okay, I'm sorry to hear that, but I'm going to offer help again next time and every time I see you because it's important. We know that it helps. Individuals can get value from a referral even if they're not reached, or if they, are reached, but they tell the helpline no thanks. Individuals will receive helpful information in the mail. We kind of talked about that, and can support thinking about quitting, planning to quit, or doing kind of a trial or a mini quit. So kind of 3 takeaways today. People know quitting is important. Tell them that you think it's important as well. Helping doesn't have to take more time. It doesn't have to be hard or difficult, and you can refer to the Maine Tobacco HelpLine with confidence. So 3 things that we're asking you to do today is talk about quitting, taking advantage of opportunities to make referrals, and really utilizing Maine Health Centers for Tobacco Independence, Maine Tobacco HelpLine. Takes less than 60 seconds to make a referral. Be a revolving door. Tobacco treatment is a process, not an event. And I always like to kind of finish with this. If you're asking everyone about a referral every time, they might not say yes. Even if your patient says yes, they still might not connect to the Maine Tobacco HelpLine. Even if they connect to the Maine Tobacco HelpLine, they might not enroll. Even if they enroll, they might not complete the whole program. Even if they complete the whole program, they might not quit. Even if they quit, they might not stay quit, but they might. This time might be the right time. I also wanted to add, looking at the Maine Tobacco HelpLine, that women that are pregnant or planning to become pregnant, it's usually a 4-call counseling. If you are pregnant or planning pregnancy, that they are eligible for more additional calls. So I wanted to add that as well. My thought is for next steps is let's go try it out. So I'll put this, can anyone give us a quick tap? Some quick can you, this is a great question. Can you give us some quick taglines to encourage people who want to quit or to encourage people to want this service? Quick taglines. That's a good question. So my thought is, you know, have you heard about the Maine Tobacco HelpLine? Is this something that you're interested in calling? Have you, you know, kind of have you thought about quitting, or tell me about your tobacco use? Would this be helpful? And that's, you know, it can be kind of, those are kind of some close-ended versus open-ended questions, but I think also I can send along, you know, whether you can kind of, this is my notes, but like if you had something to kind of leave with them, you know, a rack card as well, you can kind of reference that and kind of take a look at that together and be like, geez, have you checked out the Maine Tobacco HelpLine? And it kind of, you can kind of refer to that. I think that might be helpful. Again, you know, if you have the opportunity of pulling up the quit link with them and kind of going over that site with them and showing them, you know, what services are out there. Daniela, did you want to add anything? Or if you wanted to type anything in the chat as well to kind of answer that question, that's an awesome question. So let's take a look. If I went to the quit link, so I just typed in the quit link. I'm going to kind of move this a little bit. But if you were to go to help others quit, you can see that it says social service providers. So if this is on the quitlink.com, social service providers, that brings up that form, quit tobacco referral form. And again, we talked about that a little bit. You're obviously, when you request this for someone else, when you're putting this in, you know, I can see WIC right there. There's WIC. You know, you're putting in the first name, last name, address, town, state. Email is recommended but not required. Phone is obviously required. And again, what's the best time to reach them? Is it okay to leave a message? I think that's nice as well. And then submit form. I've also dropped off to you folks, and if you need more, please let me know. But if you don't have access to the internet at that time, or if it's just easier, I have those notepads as well that you can kind of fill out, and then when you're back at your desk, you can fill that in for your client or patient as well. Another resource I'd love to show, and again, this is just on the quit link, and I'll put this in the chat box, and I'll put this in the chat box, and I'll also share these hyperlinks with Catherine in an email. And the next one I'd love to show is if you're, okay, again, you're on the main page thinking about quitting, there's a great tab for pregnancy and tobacco use that I wanted to share. So again, another resource for you folks to share with your clients. But again, some great information. Get support to quit smoking or vaping, knowing the risks. Just some nice information there. And again, that's under the Thinking About Quitting tab. The last thing I'd love to share on this website is, again, under the Help Others Quit Tobacco, because we know vaping is such an emerging tobacco product. There's some great resources at the bottom of this for Maine Quit Vaping and Support Services. So the state of Maine now has a free texting program specific to Mainers, and it's for 13 to 24-year-olds. And again, there's another vaping, no vape support helpline as well for any adult or youth resident that would like to receive services to assist those who vape or want to quit. So I wanted to share that as well. My other resource I'd love to share is this is, and again, I'll share this hyperlink, but the Maine Tobacco HelpLine. We talked about that a little bit already, obviously, but there's different ways. There's different quit services that I just wanted to go over quickly. Obviously, there's phone coaching. We talked about that, the one-on-one, creating a customized quit plan, and that's when you're eligible for 8 weeks of free gum nicotine replacement therapy. And again, this is all when folks speak to someone over the phone, they're based in Maine. Mainers are speaking to Mainers. Another option is web coaching. So there's a website support with digital tools to help individuals through their quit journey. Again, creating a customized quit plan. There's also free a 2-week starter kit of gum, patch, or lozenge. And again, it kind of says that you can utilize any of these programs. You have to call by accessing that number, the 1-800-207-1230. And then there's some individual services as well. Again, I don't have to read through them, but wanted to kind of go over them as another option. And then there's an intensive behavioral health coaching program tailored to meet needs of tobacco users with behavioral health conditions. So that's also another option. And I'll share that hyperlink. The last thing I'd love to share is the Centers for Tobacco Independence, so CTI, always holds an annual conference, an annual tobacco treatment conference and prevention. This year, due to circumstances, is going to be virtual. And we don't know the exact setup right now. I think they're still figuring it out, but it's in the past it had been like a half a day, full day, and then a half a day. And you can pick, like, I just want to go to the full day. I just want to go to a half day and a full, you can kind of tailor, again, the program of what you wanted to participate in. Again, it's going to be virtually. I don't really know anything else besides the date, and then it's over the internet. But why I'm telling you this is that we have funding, Healthy Androscoggin has funding to send 3 folks from your staff if you're interested in participating in this conference. And then if there's more than 3 folks, there's also an opportunity through Maine Health. They have a scholarship program, so I can connect you if you would like, if there's more than 3 individuals from the WIC staff that are interested in participating. But I wanted to share that with you folks as well. So I'm going to pause and ask if anyone has any questions. That's really it on my end. Or Daniela, did you want to add? Kind of peeking at my notes. I think that's really it. I so very much appreciate your time. I'm going to share these hyperlinks in the chat box. I'd also love, the last thing, there's an evaluation, and we'd love to hear from you. And I'll share that hyperlink. If you could fill that out, that would be most appreciative. And that goes to the Maine Health folks, the CTI folks at the state.
I was just going to mention that Cindy Farrington said she would like the notepads.
Awesome.
I
Yes.
think that's a great idea.
Yes, I can do that. And also, I can, going back to the taglines, I'll include some taglines in the email that I send along with the hyperlinks. And I'll go ahead and put that in the, if folks, maybe you're at your work desk right now, I'll put those hyperlinks in the chat box right now, and you can kind of open them. And then if it's easy, you just save that right to your, not desktop, but, bookmark. So you have the quit link, boom, right there. So I can copy and paste that right now.
Yeah, Pat made a good point. She's been our champion of getting folks roped into signing up for the quit link, and from not seeing people face to face, we haven't been able to do those referrals. And since we've been doing this for the last month and a half, it's been a little more difficult.
Absolutely, I know, and it's just our ever-changing. It's just a different time right now. But we so appreciate your hard work, and you guys have had some great successes, and will continue having some great successes referring to the Maine Tobacco HelpLine. You guys are such advocates there, and we so appreciate your hard work.
Does anyone have any story they could share about successes they have had making some quit link referrals in this crazy time? Or you can either type it in or you could unmute yourself. I don't know. Off the top of my head, I don't know if anyone has or not. And crickets.
It's okay. And we have to think of too, kind of both sides. Like, this is a stressful time, and so folks might not even be wrapping their heads around, hey, this is a good time for me to quit, or hey, you know what, I'm really stressed out, I don't have the funds, maybe it's time for me to quit. It's kind of that double-edged sword. And and I know you folks do a nice job of meeting where they are. You know what,
yeah. You
sound stressed out, you're not interested in quitting right now, but next time I see you, next time I chat with you over the phone, next time we're in the office together, I'm going to ask. Maybe next time we can develop a quit plan. But I think the really important message is asking, and then having that at your fingertips. Right, all you can do is be supportive. Absolutely. Love and support. Yep.
Cool.
Yeah, too stressed out. Yep. Yep, makes sense.
Anyone have any more thoughts for Miss Emily or any questions?
Pat knows. I love that. Well, folks, thank you very, very much for your time. I truly appreciate it. I appreciate your patience with figuring all of this out, and thank you for being my first friends to dive into GoToMeeting as well. I really appreciate that. And I'll get you some more notepads. I'll send those hyperlinks out with also some taglines. And I very much appreciate if you'd be willing to fill out that evaluation. That would be most helpful. So thank you, folks.
Cool. Thank you, Emily. Appreciate you reaching out. It's nice to have somebody else talk other than myself.
Love it. I love it.
Bye, guys. Nice meeting you, Daniela.
Likewise. Thank you.
Take care.
Bye, everyone.
Bye, everyone.
Bye-bye.